Hello, it's Nurse Rosie. Welcome to my channel. If you're new here, welcome darling. And if you're an old subscriber, returning back to my channel, thank you so much for being loyal to me, and I hope you enjoyed this video. Today's video is all going to be about student nurses, how to survive nursing schools, how to cope at placement, what advice and tips would I give to new students and even third year students. What did I find useful, or what item did I take to placement to help me with my studies, to help me remember things, because there's a lot to learn at placement, and it is guaranteed you're not going to remember everything. So when you write them down, it helps you to remember. You can always reflect, go back and refresh in your mind, and you'll be good to go. So today I will have 7 rules of what you need to do, or what you expected at placement to have on you, or to behave as. So the first one will be having pen. For some reason, nurses and other health professionals expect student nurses to have pens with them all the time. I believe this might be because at uni somehow you get supplied with pens when we're having a freshers week. You get lots of pen that you can take with you, or you can actually buy a packet of pens for a very cheap price, £1, £2. It makes you look prepared and professional. So my advice would be to have at least 2 pens with you at all times at placement. I used to have about 15 pens. I know that's crazy. I used to have like 6 here, 6 there, and then a few in my bag. People used to call me the pen freak at uni, not placement. But at placement I was loved, because anytime someone needed a pen, because the J pen had run out, I'll have one to spare, and I wouldn't take it back. I would just give it to them because I had loads and didn't need it back. So my advice would be to also get a big pen where you have all the colors. At some point you're going to need the red, especially if you have a placement at critical care, as they tend to use a lot of red when you're doing your vital signs for your SpO2, which is your oxygen. I think for the temperature is not red, for the heart rate, fluid balance charts, and the balance as well when you're calculating it, especially during the night shifts, but you need it during the day as well. Also, even on the wards, sometimes the nurses use red pen to highlight something that needs everyone's attention, especially on drug charts. Sometimes the doctors will prescribe IV on a regular medication chart and not the IV chart. So when you highlight it, that helps your colleagues as well to not make any drug error, to pay attention to the route that is supposed to be given. And so having a red pen will be very helpful. The second thing I would say, make sure that when you're on the ward, you ask them where the store is. Grab yourself a pen, a touch pen, and put it in your pocket. When you're doing your vital signs, neuro obs, you need a touch pen at some point to check the people's reaction. I mean, sometimes they will say you can use your phone or the iPod to do it, but it's not very nice, as it's very harsh on patients. The eye is not, patients don't like it. And if you have an option to use this, why not just get that, look more professional instead of bringing your phone out and doing that. Get yourself a touch pen. Third one will be a fob watch. Make sure to grab one of these nursing watch. You can get these during your freshers week from Royal College of Nursing if you decide to join the union as well. I think the first year is free, so they'll give you a package for free and you have one of these in it. Okay, if not, get one from eBay. It's just £3, or even Amazon, and it takes 2 days to be delivered. So get it now before it's too late. I think this goes to newly students and even third year students. Most of the time you don't know what's required for you to take a placement. It's just like being a new student. You need to have everything that's required for your job role as a student nurse. Technically you're going to be a nurse at some point, so you have to act like one. The next one will be having your ID badge with you at all time. This does not only help your colleagues to know who you are or even security. Patients, deaf patients, patients with hearing issues. Most of the time when you introduce yourself to them, they'll be like, pardon, what do you mean? What did you say your name was? Just pull this, just show this to them. This is my name, this is me here. If you need to spell it out because it's too small, they can't see it, so do so. But when you have this, it's really helpful. Patients prefer this. Sometimes patient likes to write your name down as well in your little books. I don't know why, but yeah, have your name badge as well all the time. That'll make you look professional, helps patients to actually read your name as well, and your colleagues. Most of the time health professionals do not remember students' name because obviously there's a lot of colleagues around and they tend to forget. And as a new student joining the team, it's expected that not everyone will remember your name. So when you have it, for them to not refer to you as the student, they will look at it and call you by your name, which is more respectful. The next one will be to have a notepad, pocket note. Let's see if I can find my one. Give me, oh, actually I might have it on me. Do I have it? Yes, I do. Grab yourself something like this. So this one is still from placement when I was a student. So I recorded everything here that I wanted to learn and be competent with the medication names and the sedations and all that. At this time, I didn't know anything about medications. I was in year 2 and this was actually my first hospital placement. So I put all the stickers here. You won't have stickers in all placements, so you can write them down. What I did was I wrote some medications down was here. As you can see, I used red pen because I wasn't sure what they were for. Some are blood pressure medications, and some are heart rate, some are pain reliefs, and I didn't want to mix them up, so I just wrote them in red so I can remind myself. Now of course I know them. And here was respiratory assessment to remind yourself the things that you're not very confident with. You just write them down and refreshing your mind when you need to. I also wrote some codes here, my shifts, just be prepared, because most of the time they will not put you on health roster, and so you have to write your shifts down, and it won't look very nice going around asking your mentor or even the ward manager, oh, what's my next shift for next week, when you've been given it already. Look professional, be prepared. The next one will be, when a placement, be proactive in your learning. Be proactive in terms of learning new things. Do not be afraid. I know that most students gets into nursing without even having any healthcare background experience, which is fine, but you have to put yourself out there. Do not hold yourself back. Don't think that you can do it. Yes, you can do it. I've been there, I've done it. You will do it as well. We can all do it. Okay, so let's say that your placement, your first day, you're not sure what to do, you're just observing the nurses, and then the next day you do something. That's fine. Once you've been shown how to do vital signs, you can carry this out and ask the nurse to observe you if you're not very confident. Just do the vital signs. When you're not sure, ask the nurse. If you don't know the normal range, it's fine. Just make sure once it's done, show it to someone, and if there's something that they need to act upon, they will do that. And when they do, or if something like that happens, make sure to ask, what was it that you needed to react to it, or what is this for? Let's say they give fluids, you don't know why they're giving fluids to patients. It can be that your heart rate is maybe high, it can be they have low blood pressure, which is they're hypotensive, or they can be hypertensive. Even when they're tachycardic, we can give fluids as well. So make sure you ask the reason why we're giving that fluid. That will be very beneficial in terms of if you have visitors around, or even the patient can ask you sometimes, what am I having this fluids for? Why? So it's good to have that basic knowledge so that you can just say, oh, because your blood pressure was high, your heart rate was high, or because you're dehydrated, or because you have infection. It's just, those common things that patients expect you to know, even if you're a student, because you're looking after them. Okay, the next thing will be back to uni. When you are at uni, please make sure you pay attention in class. Okay, you can focus if you do not know what the teaching. Even if you do know what they're saying, please do focus, because it really helps you. And after lectures, when you go home, please revise. Just look at whatever you were taught again. Go on Canvas if you use Canvas, or whatever teaching technology or whatever you use. Please visit it again, just refreshing your mind. Recap and see what you remember and what you forgot. If you have a learning mate or a flatmate that you have the you're doing the same course together, please get together and share ideas. I was lucky, I had a flatmate, I was doing the same course, we were actually friends, so we used to just, you know, refresh our mind. If we don't, we used to question each other, listen to each other explain, you know, pathophysiologies, because that was really hard. What helped me, oh god, okay, give me 1 minute, I need to shut the door, sorry guys. So what helped me a lot was my laptop, going on YouTube. So what I did was, I forgot the name of this channel, but I went on YouTube and typed in whatever I wanted to know, something like DKA, or even how the heart works, so pathophysiology of cardiovascular system, respiratory system, circulation system. Just type it in there, pick one video, watch it. When you're done, turn it off, repeat what you remember to yourself, write it down, stick it on the wall. When you wake up every morning, look at it. After placement, look at it. After work, look at it. After unit, look at it. That's how you're going to be so competent. In my clinical discussion, I got a sepsis, and during the clinical discussion we had, I think, 7 or 9 cases that you could have, and you were not told what you're going to get. So we had to learn, study 9 different conditions that you could potentially get, and you have to explain the pathophysiology, the signs and symptoms, the treatment, and all of that. Okay, so it was quite hard, and I was lucky to get sepsis, because sepsis was not too complicated, but some people that got that struggled. I didn't struggle because of what I did. I wrote it on the post, put it on my wall. Anytime I woke up, I would look at it, and everything was here as if I knew the RAS system. If you're in your second year, make sure you know the RAS system, because this can apply in all conditions. In all conditions, the RAS system will be involved. The circulation system, get everything here, even the cardiovascular system, because we obviously, the brain will send message to the body when there's something wrong, so somehow it applies. Let's say that you get hypovolemic and you forgot everything, just talk about the cardiovascular system, how your body will know there's something wrong. And if you're not at this stage yet, you can get yourself prepared as well. Don't play with your pathophysiology, because it's going to be your best friend even when you qualify. Because when patients are presenting with new symptoms, as a nurse, ideally you should have an idea of what's going on with the patient. Don't leave it all up to the doctor. Okay, so I will have to leave it here. I've got to go, basically. So as you all know, we're in a second lockdown in UK, London. My next video will be about how we're coping at the NHS. Do we have enough staff? Do we have enough PPE? Do we have the resources that we need? Are people coping? Are staff going off sick because they can't cope? How are the stress levels? Are they raising or going back down? I will let you know what's going on. Are people following the rules? Are people staying inside? Okay, please make sure to wear your mask. Wash your hands frequently. Wash your hands. Stop the spread of COVID. Help the NHS. Protect the NHS. It belongs to us all. Let's protect it together. Thank you, and do not forget to like, comment, and subscribe. Turn on the notification bell, and I will see you all in my next video. Love you all.